Hello and welcome back to the podcast, to all of our podcast listeners and to all of our members in the Women's Health and Ayurveda Sisterhood Facebook group. Today we have Dr. Mary Beth Brinson with us to talk about a really wonderful, new and inspiring tools for children with attention disorders. So we are going to introduce her as the TALi Health CEO and Chief Medical Officer, Dr. Mary Beth Brinson, the former Vice President of Global Clinical Affairs with medical devices leader Cochlear Limited. Dr. Mary Beth is now leading TALi Health towards pioneering a new digital solution to safely and effectively address one of the world's most common neurological issues, inattention. And specifically, we're talking about the inattention of children. So welcome to the podcast, Dr. Mary Beth.
Thank you. Very happy to be here.
I'm so happy to have you. And Dr. Mary Beth is actually streaming in from Indonesia. So we just had that brief conversation before we hit record. So please apologize to you all if there's any glitches with the internet, because we've had a little bit of glitches coming back and forth and slight delay. But yeah, stay with us because hopefully it'll all go nice and smoothly. So Dr. Mary Beth, could you please explain a little bit about this new digital solution?
Sure. With COVID, certainly people have had to do things differently. And we had to do education differently. We had to do our medical appointments differently. And with the being forced to do that through COVID, I'd say these tools have been around for a long time, but change is hard. There's been a lot of awakening about, wow, maybe there are ways that increase access and relieve some of the burden that comes with having, say, a chronic issue with a child or an adult. And the digital platform for medicine is new. It's not new in its availability, but it's certainly new in its uptake. These types of interventions have traditionally been very hands-on, which means, mom or dad or somebody picks the child up and takes them to a center, and a physical exchange of therapy ideas and practice happens, and then mom, dad, caregiver goes home and tries to extend that at home. And there's an opportunity now to provide a different sort of access through digital therapeutics. And so we're operating in the area of attention and offering to professionals who can then access it for their patients an opportunity to do some work at home. It's really great because it gives the parents an opportunity to do therapy in their own time and what makes sense for them, assuming the child's awake, but it can happen, whenever it suits them. And it also provides the therapist with an opportunity to see the child at home. Oftentimes, if you've ever worked with kids, they come into the office and what you hear from parents is, oh, they never do this at home. This is not what they're doing in school. And so it's just another window for the therapist to see behavior, even though it's not videoed, it's, to see an output of behavior and how they are achieving at home. So it's got lots of opportunities for access and providing extra information for therapists.
Yeah, beautiful, wonderful. And you're so right. Like whenever I take my children out, they're always a lot different to what they are at home. So 100% with that. So I guess the children that you are helping, they've already got a diagnosis, I'm assuming?
Not always. And I think what is also unique about TALi, we're very careful to talk about attention issues. Everyone automatically goes to ADHD diagnoses, but ADHD diagnosis happens often quite late, unless the child is, really, really severe or has additional difficulties. The average age for ADHD diagnosis is about 7. And usually it's a behavioral diagnosis, right? It's, through school and the child's exhibiting behaviors. They can be quite disruptive or upsetting. And you eventually get down this path where you get a diagnosis. But attention issues can be seen quite early, and they may or may not come with a diagnosis in time. And with developmental issues and ADHD, autism, anxiety, those are developmental disorders. What we traditionally see is, it builds over time. And what we want to do with attention is say that, there are some ways that we can address early attention symptoms. TALi's tools are from 3 to 10. And so we can start quite early. Some of these kids will go on to receive a diagnosis in time, and some won't. Some will just have some, need a little support through the development of attention. And in our case, it as long as they're working with the, a clinician, a therapist, doesn't really matter. It doesn't matter if they have a diagnosis or not. As long as it's been noticed that, there's some focusing problems, some attention problems, the tools can help.
Sure. So what are some of the signs and symptoms of inattention that the kids would display for the parents to then sort of reach out for TALi Health?
Yeah, look, it's one of those things, it when you see it. And traditionally it is, and all toddlers do this. So that's why I think it gets to school age, and the teacher who sees so many of these kids every single year can say, yeah, that one. But it is, compared to their peer group, inability to follow through, inability to sustain, inability, the traditional kind of running around, moving focus from things to things, or hyper focus. You just can't get them to, stop watching Cars, the movie, or something like that. In comparison to their peer group, that is, not typical. So attention in anyone develops. It develops over time. Very young children have poor attention by definition. And so I would say that it is the inability to focus, for want of a better word, or hyper focus as in a way that is different from their peers, or different from maybe what you recognize with your older children.
Sure. And can you differentiate the difference between inattention as opposed to ADHD?
Sure. ADHD is a, and I'm going to use the medical words here, and I want to be really clear, because I think the neurodiverse community is pushing back hard on these diagnoses. But let's use the medical terms, because it is a disorder that is defined by the DSM, so the diagnosis manual that medical professionals use, and is a collection of symptoms. It is not a single point of diagnosis. And it is typically diagnosed, not always, but typically with a collection of observation of inattentive behaviors, usually from school, is, because people often don't see that until it gets into a group and you've got one teacher trying to manage 30 kids. There is often some psychometric testing, some cognitive testing. So there are some tests that, like a TOVA test, that looks at attentive behaviors and kind of compares to a typical age group. And then a diagnosis gets made. And that's part of the rationale for being older, is that, it takes a while to get on this side of you are outside the typical bounds in ADHD. So that is a formal medical diagnosis. And there are, there's not a standard of care, but there are some pharmacological interventions for that. And there's some behavioral management exercises for that. We're inattention right now, because the age of diagnosis for ADHD outside complex children is quite old. Inattention is just, like I said, it's looking at a peer group or the siblings of the child and saying, they could really use some support in this, because they are struggling a bit, compared to their peer group. And it doesn't necessarily go on to meet the criteria in the DSM for a formal diagnosis of a, neurotypical, atypical child.
Yeah.
So that's a big difference.
And do you feel like the ADHD diagnosis is sort of, I guess, not just handed out, because I'm not talking about being handed out by doctors, but questioned in many children who potentially just displaying signs of inattention rather than true medical diagnosed ADHD?
Look, it's such a complex area, and it is such a sensitive area right now, the, neuroatypical diagnoses. It's an area getting a huge amount of, pardon the pun, attention right now because of the impact of missing the diagnosis. So children that grow up with the inability to regulate behaviors, they go on as young adults, and they can go on to have some significant issues. And those issues are failure at school, failure to work, some mental health issues, and those kinds of things. And so the whole medical community has said, you know what, guys, this is not a nice to have diagnosis. It's not just label them ADHD. There are some real issues that need to be solved along the way for these neuroatypical child. So I don't, I got asked before, is there really that much ADHD out there, or is it just being overdiagnosed now? Certainly the focus of looking at it because of the poor outcomes for young adults has caused a big scientific swing to say, hey, let's look at this harder and see if we can separate out, the children that really need some support. I think from my mind, having worked with children with developmental issues for so long, is right. Does it really matter if your child needs support at 3 or 4 and can do something that makes it easier and better? The diagnosis coming later is not such an issue. It's the failure to act that I see causing a lot of trauma. So for families where they do go on to get a diagnosis at 7 or 8, they've been plugging away at this for years with their medical professionals, saying, help me, help me, help me. It's really disruptive to our family life, and it's really disruptive in school. And it's almost a diagnosis of exclusion, honestly, we've looked at everything else, and now we're going to say ADHD, and then you start traveling down that path. So everyone would like a definitive answer, but developmental issues are difficult by design. You can't see them. Broken leg is easy to see in an X-ray, right? Everybody can look at that and say, well, that's not the way it's supposed to be. Where developmental issues, they're occurring at the cellular level in the brain as it's structuring after birth. And there's such a wide range of typical, and you can get to an outcome that is typical in an atypical way. So it is very difficult right now. And I don't want to marginalize anyone in their experience that they're having right now. I do think that the focus on ADHD and the research and the dollars from governments will lead us to a better understanding of it. And I put autism in the mix because it's happened most recently with autism, where the age of diagnosis used to be well over 5. And it was very similar. Wait till they get to school. We'll see how bad it is. And so except for the children with the most severe autism, those children kind of floated, and parents tried to cope and teachers tried to cope until they could get a diagnosis. And then when people realized that autism as a developmental issue was better served by acting very early, they found ways. And now the average age of diagnosis is like 1.5 years. You have screeners available. And it's not because you need the diagnosis. It's more because if you know early, you can provide support. And that support produces better outcomes for the family and for the child. And ADHD is the same.
Yeah, sure. And I understand we're talking about children with inattention and possible ADHD, but I just wanted to bring to the conversation, and I don't know, I'm probably not going to articulate this and word this in the most appropriate way, but I'm just going to put it out there. It feels, I'm in the women's entrepreneurial world, as you are, right? And it feels that at the moment, it's very on trend to be diagnosed with ADHD in the women entrepreneurial circles, and women who don't actually have the diagnosis are saying, I have ADHD, but I just channel it into my business, or I don't know. Have you experienced this? Can you speak on this from any level?
Look, yes, certainly. Well, I don't have ADHD, so I'm, I think look, it's complex, right? The adults I know with ADHD have really struggled. They have really struggled. They've been seeing therapists for a long time. They've struggled regulating anxiety and, behaviors that have led to struggling in school or professions. So I applaud you if you on your own have managed to bring ADHD under control by sheer will. I think that is really a good thing. If you understand these neuroatypical diagnoses, what happens at the cellular level that is expressed through sort of executive function is real difficulty in controlling things like fight or flight, regulation of emotion, and channeling those and learning how to calm yourself down, regulate yourself. I think you'll find adults that truly have ADHD, in addition to medication, perhaps they are big into meditation, and because that fight or flight reflex, it's a reflex. You can't control it. That's the whole point, right? If you've got to get out of the way, you want your body to take over. When it happens inappropriately, so in a meeting or something, if something triggers fight or flight, a lot of your responses are people, what's wrong with you? So yes, I get it's kind of trendy and people say it's the reason that I'm successful. I just work all the time. I think it's kind of mixed up with that hyperactivity, attention deficit hyperactivity disorder. So I'm going to, I'm not everyone's doctor, and, I'm going to let them be successful on their own. But I don't want people to feel like if they just tried harder, they could bring this under control. Because frankly, it's not that easy, and not being able to do it on your own as an adult or as a child is not a failure in you. It's hard. It's why people struggle.
Absolutely. And I'm certainly not discounting any female entrepreneur who has ADHD, that their diagnosis isn't valid or true or anything like that. That's absolutely not where I was coming from, but more so that there is a lot more women who have been diagnosed with ADHD in the female entrepreneurial world, and just so happens a lot of them are very high profile, very successful, and then a lot of other women I have heard, saying, oh, I've got undiagnosed ADHD. So that's sort of where I was coming from, and I wonder if it's more maybe they do. And that's absolutely a possibility. Maybe they're not as educated on the topic, and maybe they're just very high functioning women with high anxiety, type A personalities that always, need to be doing something, working, have a busy mind. Like there's a big, I guess, broad aspect of what that could look like. And yes. I think ADHD, from a diagnostic point of view, you have to meet a certain criteria, as you alluded to. That's
much like autism. If you remember back in the day, you had autism or you didn't. And then they said, oh, no, it's a spectrum. So, and we started looking at, it used to be called Asperger's as high functioning. It's no longer the term you're used, and then, when they put it on a spectrum, you've got a spectrum, you've got all kinds of outcomes, and ADHD is the same. It's a neuroatypical diagnosis. And, they're going to be on that spectrum, people who can manage it and cope and hopefully thrive, all the way to, real issues that they're going to need a lot of support for. And it's no different than autism. And there is a spectrum, and women are different too, much like autism, where the symptoms are different. So if you look at, the symptoms of autism or ADHD in boys, girls produce they mask better. The amount of girls that get to adulthood and, are like, oh, well, that's what it's been, maybe higher because they mask, the symptoms present differently. And so I think it's a real difference between the genders and how their cortical organization happens and how it manifests. You accept a lot more of the dysregulated type of behavior from a boy. Oh, he's just a boy, send him outside to run for a while, kind of attitude. So it is very interesting right now. I can't really think of a more interesting place to be in science is in this area of neurodiversity, because the whole thing is changing. And rather than saying you're broken and that's bad, it reminds me a lot of dyslexia, where before dyslexia was known about and understood, And dyslexia is just the inability to read code, written code, language code doesn't represent on the brain the same ways it does for everyone else. And so those children grew up, struggling with education, failing out of school. And then when somebody said, they just see representations differently, and this is how you educate them. And, you end up with the same thing. Famous people saying, well, I have dyslexia. It's no big deal. I just cope like this, or I cope like this. And I think of that as another type of neurodiversity, if you will. And ADHD is just probably the one that's most ripe for better definition, and better therapies and better interventions, rather than, just the typical pharmacological, suppression of, medication that just kind of suppresses those behaviors. It's how do you live with it? How do you cope with it? And how do you thrive with it? I think as a parent, that's what I would want to know. Is great. The brain organizes differently. Fine. What do I do? What does school do? How do I help my child live their best life? Because you're not going to fix it like a broken leg.
Yeah. And so going back to children with inattention and ADHD, how do the results differ through the TALi Health process?
So what TALi is working on is attention training. So cognitive attention training. So if I can explain it, you know what a brain looks like. Everybody knows what a brain looks like. The way brain development happens for children is that you have all these senses, feeling, hearing, seeing, and you have these big areas of the brain that receive that input. And then over time, all of that rolls up to your frontal lobe and is processed. And it's something called executive functioning. Your brain sorts it all out and says, when this happens, I'm supposed to do this. This is what's acceptable. And, your parents, your caregivers, they all kind of frame that when you receive an input and you react in a way that's outside the norm, you get reinforcement. Don't do that, do this. Don't cry during, weddings, for instance, take that outside. And so if you think about it that way, there's cognitive attention, and that is literally at the sort of input stage. That is a cognitive development. You develop cognitive attention. The behavioral attention is what comes out in the executive function area. So that's why ADHD is a behavioral attention diagnostic. You need to see how they have coded that and can they regulate their behaviors. There's a big difference between when this happens and when this happens. When the executive functioning develops, well through teenage years. And what TALi is different is we're trying to represent and encourage development at the cognitive, at the cortical level, well before it's mapped behaviorally. Anything that is coded and represented behaviorally is harder to undo because it's saying that, or harder to change, if you will. If you think how hard it is to change your behaviors, it's because that input has been coded and that's how it represents to you. It can be done. So that's what TALi is different. We're working at the cognitive attention level and saying, look, let's see if we can improve and that's what the data support, that you can improve cognitive attention. You still require often intervention to make it represented all the way through the behavioral attention. But we're offering tools to help develop cognitive attention. It's entirely possible that behaviorally, things can happen that happen so that the executive function doesn't develop well. But ADHD and these attention disorders are going to have a root in cognitive attention. And so we're trying to improve it as it develops, as opposed to remediate it once the behavior is there.
So currently you're just working with children. So if like adults, as we were talking about, say the female entrepreneurs who have been recently diagnosed with ADHD, would they also benefit from what TALi Health offers? Or is it more you have to catch it earlier? And is it when people get diagnosed in adult life, is it that the diagnosis has been missed, or has something happened to create a new diagnosis in adulthood?
It's a really great question. So the reason that TALi is really suitable for children is that we have gamified the training tools. So you can train attention. That's, like I said, been published on meta-analysis looking at that. You can train cognitive attention. It's usually done one-on-one with a therapist. So we actually have gamified it. So it happens on an iPad, and that is, that's really exciting. If an adult wanted to, the games are for 3 to 10. So I'm not sure that an adult would find that terribly entertaining. And training attention is funny because the algorithm that's in there is that you've got to hold their attention, but not too much. Can't be too fun. It's got to be just fun enough. It's got to be a little bit dull. So it's complex. I'm not sure that would work for adults. However, adults wanting to do attention training at their therapist's discretion, absolutely. There are lots of ways that they can train attention. So that's why we're working on this. We're focusing on this younger age because we believe that's the area that the tools are missing for development. People just pass it off and say, there's nothing we can do right now. And I say, oh, there is something that we can start doing now, with the idea that eventually it leads to better outcomes on developmental. And, it's ADHD by definition is a developmental disorder. It's not an acquired disorder. So you can have attention issues that come from like having a car accident, a brain injury, some kind of stroke. You can affect the part of the brain that's already developed. But by definition, ADHD is developmental. So that means it's happening. What typically happens with anything developmental, particularly mild stuff, is it gets missed because children are they can cope. They either have a home life that, accommodations get made without even knowing it. And so they're able to cope. Sometimes it's the wherewithal within them. They're extraordinarily high IQ. IQ masks a lot in children, a lot. And so, if you very, very issues like that, I think that's the link to autism and IQ, the very high IQ, the joke about them being engineers kind of thing, that it masks that and you kind of say, oh, they're just brilliant. So by definition, it can't happen later. It has to be during your developmental stages, unless you have some kind of incident, accident.
Yeah, sure. Well, perhaps with entrepreneurs who have ADHD, because they have to, infuse so much intention to their business to succeed, maybe that is the attention training,
Yep.
right? Maybe that really does help them. And that's why they're so high functioning, because they have been able to bring all their attention into their business, and it teaches them to focus because there's that success being driven behind that.
Or they're hyper-focused. Their attention issue is hyper-focus.
Yeah.
And they can hyper-focus on something they're passionate about. And, God, that would be every entrepreneur I know. They love what they do and they think about it day and night. And you wouldn't call that a disorder. Some people might, you know what I mean? And it could serve you well, as long as you've got a way to, it would be damaging to stay in fight or flight all the time. That kind of chemical release in your brain, that's not good. So if they find an outlet through, something they're passionate about.
Yeah, brilliant. And just coming back to your process with TALi Health. So you mentioned it's like gaming apps for children, which is, very, I guess, easy to get kids on board with, right? Especially these days. So that's a great thing. Do you do a collaborative approach with it, or is it just a gaming app and they go through stages like a traditional game? You go, I'm not a gamer, so I can't speak from expertise, but like you pass a certain level and then you go to a next level. Is that sort of how it works? Or do you have a collaborative approach with, the therapist, maybe occupational therapist, speech therapist, or like a team? Like how does it play out for a child who comes to see you with inattention disorders? How does that sort of process look like?
So TALi is aimed at healthcare professionals because of the complexity of, what's going on here. You may have multiple professionals. You may have psychology, occupational therapy, speech therapy involved. We are a tool for therapists who feel like, and I say therapists, it could be a pediatrician, it could be an OT, a PT, a speech psychologist, anybody who wants to, who feels like a training for cognitive attention, particularly something that's done, at home, would be helpful. So we don't sell directly to parents, mostly because of the complexity of the diagnosis. And, we don't want parents to think that they've got this under control. And it turns out that they've got a 7-year-old with very bad anxiety and an awful diagnosis gets missed. Yeah. So that's not what we do. It is collaborative in that, and the ADHD Society just released new guidelines for Australia, which is fascinating because we do feel very collaborative in that we provide through a portal reports for the professional to give them assessments of these cognitive levels so that they can incorporate it in the therapy and say, yes, we'll do this. But it also encourages and helps the parent to become involved in the therapy, which if you've ever worked with children, they have to be. There's no way that a child's going to go to a therapist, listen to 40 minutes and go home and extrapolate it across their life. That's not how any therapy works, actually, any therapy. It is, you go talk to somebody, they give you some tools, and then you go practice those tools, whether that's OT, PT, psychiatry, psychology, it all works that way. And we just consider ourselves an extension. It helps the parent remember, as they're sitting there with the child, a 3 or 4 or 5-year-old can't do it on their own. And they kind of get to go through the levels with the child. They can see where the child gets, has struggles or where they're excelling. And so it encourages this parental interaction at a real therapeutic level that is beneficial for the whole ecosystem of these children.
Wonderful. And so would the process be, if there's a parent listening to this podcast and they feel that their child has inattention disorder, would they then go to their general practitioner and get a referral to a specialist to then get referred to the TALi Health app?
Yeah, I think this is pretty new.
Yeah.
So your chances of getting to a professional who goes, what? And I think the developmental nature, where if your child's particularly young, you might just get a bounce back. So absolutely, they can contact TALi and we can provide professionals that can help understand and they don't need a diagnosis to enter this area, which is good. I think sometimes managing to a diagnosis can be a problem in our kind of Western healthcare systems, right? You can't get help unless you get a diagnosis, and you're just thrown into this medicalization channel, which, is challenging. So yes, switched on professionals. We can provide professionals that provide access, because I think that we would always want to make sure that someone who is a diagnostician or has the whole healthcare of the child involved is paying attention, if you will. It's bad, and I'm sorry, bad, bad thing, but that's what we mean. So you could contact TALi if you're not having luck with your professional. The good other thing about attention training is a do no harm therapy. You can't overtrain your attention. So it's not as if, well, they had inattention and now they've got hyper-focused attention. That's not how it works. So in a lot of ways, it's a productive game. If they're going to play games, do this one. Doesn't hurt. It's a no harm, no foul therapy in a lot of ways. So if you think they're having problems of attention, if your preschool teacher has said, you might want to have this looked at, and you've taken them to the GP, and the GP's like, they're 4, wait a year. This is an option for those kiddos right now, and parents. And it, like I said, it produces such a lovely interaction between the parent and the child, so that you're not just labeling behaviors, you're actually seeing them work through the levels of the game, which is exactly how it works. It's let you do this. Can you do it? Next level, it's harder until you can't. And then it drops back down, and again and again and again. And you can actually see your child thinking rather than waiting for your child to produce a behavior that you're just not crazy about.
Mm-hmm. And so can neurotypical children also have benefit from this? Yeah.
Yes.
And so what would be the difference between them doing this sort of game? I'm assuming that obviously there's been it's curated from medical professionals, but just for the parents out there listening, what would be the difference between doing this game as opposed to the other sort of games that are out there holding the child's attention?
Look, I think it's not just game, and there's quite a bit of research out there now about like playing video games. And I got asked last time about, well, video games are associated with ADHD. I was like, oh, wait. So let's put our real scientific hats on and look at what those studies are showing. First of all, for children to use modern technology to learn, and as long as there's learning, that's not the same as, using a game for non-productive learning. And I think it's a lot like, anything out there, if you can have cognitive difficulties with children who are not stimulated with learning opportunities, I think terrible stories about like Russian orphanages and things like that. They end up with permanent cognitive problems, even though they've had stimulation. It's just not the kind that we know leads to cognitive development. Mm-hmm. And so there are games that children can play. What you would look for is that the games have been researched with randomized controlled trials. This is actually a medical device. TALi's tool is regulated as a medical device because we've got therapeutic claims. We claim a benefit in a cognitive area. As a parent, you should always be asking, well, how do you know this works? Can you show me the proof that this works? And that will really separate out, game tech from medical technology. And so all games are not productive. Sometimes they're just good stress release. That's what I use mine for. But, they're not helping me in any way. But then there are some things that I'm sure all the adults out there will know. They have some stuff on their phone that's just crap. And then they have some stuff, I call it crap tech. And then they have some stuff like meditation apps and things like that actually has some science behind it. And they kind of help you and facilitate. So the first thing I would do as a parent is always ask, can you show me the studies that, is your device, is your therapeutic regulated as a medical device? And if it's not, why not? Do you not have the data to support the claims that you're making? So this would be no different than any other sort of medical device you use. You'd want to understand what the science behind it was.
Yeah, 100%. Yeah, definitely. Well, yeah, it's super interesting, and I'm really happy and excited to be able to share this information, being such a new solution and new invention. So yeah, I really appreciate you coming on and sharing this knowledge with us. So that's really wonderful to hear about it. Is there anything else that you would like to leave us with today?
Look, I think in the end, particularly in this area of ADHD or inattention, it's a rapidly developing area. As parents, I remember, it's easy to be patted on the head and sent away. And I think you have to keep at it. The ADHD guidelines, one of the things it calls for is, more help, better options, more options. There are very few options in this area right now. And I think what TALi are trying to do is say, look, we've got some scientific based options. We're working on more. And as parents, don't accept necessarily, if you think there's something going on. I used to teach my students, the foolish clinician ignores parents and grandparents if they're concerned. Yeah. Even if you can't put your hands on it right then, don't dismiss them. So, keep at it, keep demanding better options for your kids in these emerging and evolving areas.
Yeah, absolutely. And look, I said I'm going to let you go, but I did just have one more question, actually, just because we have been talking about hyperattention. So with this app, can it help regulate hyperattention? Because I'm just picturing them being like then really, enthusiastic and hyperattentive to this process and this app.
So it does different types of attention. And so, there are kind of 5 different types of attention. Okay. And the most associated one, if I can just use what people would see, ADHD is most associated with inability to focus. All over the place. I can't watch anything for 5 minutes. Whereas if you look at autism, Autism is associated with hyperfocus, right? They get in there and you can't get them off things. Actually, somebody who has developed attention appropriately and has the executive function, they can do both. There are times that we need to hyperfocus, and there are times that we need to switch our attention. And we can all think of times we need to work to put our head down and ignore the distractions. But there are other times, where we've got to bounce back and forth. You're doing this and women are good at it, doing, multiple things, and know when to pay attention. And so the type of attention that TALi trains, it works on all of those. So it does a little bit of switching, which is you need to pay attention to this now instead of this. And it comes up with separate scoring in those attention areas so that you can see, or your therapist can see where they may want to, focus on issues.
Wonderful. Yeah, it sounds amazing. Thank you so much. And you mentioned that if parents did want to get help, they can go to the TALi Health website to find a therapist that is up to date with this new technology.
There's an inquiry, ask TALi, and you can just put a question in there, where do you live, and what do you need, and we can point you in the direction of therapists that may help. And again, TALi may not be the right tool for them, but we can put them in touch with therapists who are very, very interested in helping you find what you need.
Okay, wonderful. And what is the website?
It's TALi.com.
TALi.com. Easy. That's
yeah.
TALi, and I will put that in the show notes as well. So wonderful. Thank you so much. Really appreciate your time, Dr. Mary.
Thank you for listening. I appreciate it.
You're welcome.